Hey everybody, it's Dr. Shiller here. Welcome. And today we're going to talk about why so many people say fibromyalgia has no cure and why they're often wrong. So we're going to look at it from an integrative point of view. As you know, that's what I do. I do integrative medicine. So it's conventional medicine along with perspectives and practices from natural healing. And so my perspective is a bit different than the mainstream organizations and probably your doctor. So let's talk about that and see if it can be helpful for you. Probably the reason you're watching this is because you want to have a clear diagnosis of what's going on, and you want to have a credible treatment with a good hope of feeling better. And you also want to deal appropriately with all your other medical problems if you have any. And many people with fibromyalgia or chronic pain, chronic neurologic problems, brain injury, neuropathy. There's a lot of medical problems that have this situation where they get the best medical care and you're still suffering. And what do you do with that? So people continue to suffer. There's a lot of confusion, and frequently it's going from one person to the next and getting your hopes built up with these cycles of hope and then disappointment that often for many people leads to despair. And that unfortunately feeds into the situation, creates more suffering. It can actually worsen the pain, it can worsen disability, and lead to a really difficult kind of vicious cycle. And a lot of people lose hope in conventional medicine and understandably feel resentful or actually hurt and angry. So I'm trying to speak to those issues today, if that describes you or anybody you know, because in my view there are solutions and there's ways to sort of deal with the situation so that you can actually feel better and live better and love your life again. So I see it from a perspective from the inside, having gone through and trained in conventional medicine at some of the best hospitals in the world, and then having kind of a broader integrative view because so many of my patients over the course of more than 20 years had problems where conventional medicine didn't have answers. And so I looked into other ways of thinking about it and saw a lot of people who were so-called helpless, who so-called tried everything, who actually made significant recovery. And so I want to speak a bit about that and why it works, and unpack and help you understand why conventional medicine doesn't get it and what to do about it. Because I want to improve your relationship with your doctor, and I want to improve your capacity to heal. There's reasons why it's good to have a doctor who you trust and can work with. But just like you wouldn't want your endocrinologist to operate on a broken hip, and you wouldn't want your orthopedic surgeon to help you with your thyroid medicine, you don't necessarily want a sort of acute care model conventional doc who thinks in a very particular sort of way to try to help you deal with a complex multifactorial lifestyle issue like the problems we described above. And so let's unpack that, and let's think, and we'll think together about how you could potentially address that. Okay? So first thing I just want to share very briefly as an overview is that the integrative approach and the way I think about it is very much based on you learning things to do for yourself, and also doing things that are a bit more subtle and a bit more about bolstering your body's own capacity for self-healing. And there's kind of three general realms of that. And I call it the 3 M's. There's kind of like your metabolic biochemistry. And that's where medications fit in, but also nutrients and diet, and looking at environmental influences and toxicities and things like that. Metabolism, biochemistry. And then you've got your mechanical structure system, your movement system. And movement and exercise at your level the right way is an incredibly healing approach if you find the right things to do. And the final one is your kind of mind, emotion, spirit aspect of who you are. And we're going to unpack these three in a bit more detail, but the point is that you are an integration of those, and all three of those realms are incredibly important to the healing process, some more important than others depending on the person. So let's understand the problem facing modern medicine and why modern medicine doesn't get this integrative approach. So fibromyalgia and chronic disease in general, and this is true about chronic neurologic problems and old injuries and chronic pain and autoimmune disorders, by and large conventional medicine looks at things in a fragmented way, and it doesn't really look at all of the systems as they connect to each other. We've got piles of research showing up in the past 10 or 20 years that are starting to see profound interconnection among your various bodily systems, which motivates an understanding and sort of utilization of that interconnection in the healing process. But by and large, the average doctor hasn't caught up with that research because it takes a while before it turns into clinical practice. And so we've got kind of a fragmented way of looking at it. Your doctor's going to look at you and say, oh, well, you know, you don't have a thyroid problem, bye. Or you don't have a broken bone, bye. Or you know, you don't have any inflammatory markers in your blood, so you don't have an autoimmune disease, bye. And they're not necessarily looking at the subtlety. The other one, like, well, you don't seem to have like anxiety or depression, bye. But what they're not looking at is how all of those things are intimately related to each other, and how on a subtle level the function of your cells and your physiology can be affected by subclinical changes in all of those measures that kind of add up when the whole system's interacting as one unit. And that's what a lot of us look at in kind of an integrative medicine sort of way. So the fragmentation rather than systems biology. We'll unpack this more. These might be new ideas. You know, I want you to understand it. Part of the challenge is that you are complex. We're all complex. We've got all these multiple systems, and so far, like, medical research is much better at looking at simple problems. Like, we have a bunch of people with high blood pressure, and half of them got this placebo and half of them got this medication, and look, the ones who got the medication did better, let's use it. So that's fine if you're keeping all the variables the same except one thing, giving a pill. But it's a whole different story if you're looking at multiple lifestyle interventions or even multiple nutritional interventions. We'll unpack this all more. The biggest issue, again, here is that there is an assumption that's built into a lot of medical training that I believe had its roots in the amazing changes in medicine that happened when antibiotics started to be used, right? Because suddenly people who were sick and dying of pneumonia would get penicillin, and you know, it was a complete change in reality. The average doctor would have a patient come in with pneumonia, and most of them would die. And then along came penicillin, and people would come with pneumonia, and most of them would go home in like 3 days and not even go to the hospital. So we came up with this approach of like one problem, one cause, one problem, one cure. And again, that works, or it used to work, with infectious diseases. That model's even breaking down with the sort of development of all these antibiotic-resistant organisms and certain sort of viral plagues that we have in the world that are very difficult. But the point is that complex chronic issues like fibromyalgia, chronic pain, chronic regional pain syndrome, chronic traumatic brain injury, spinal cord injury, peripheral neuropathy, we've got multiple different things going on. And if you follow the fibromyalgia literature and even the news about fibromyalgia, you'll see this reflected, right? Over the years, if you watched the news and you went back in time and you looked at snapshots from, like, you know, 2000 until 2020, you'd see, well, fibromyalgia is caused by increased pain sensitivity. Great, that's the conventional point of view. At one point, we understand that, oh yeah, there's small fiber neuropathy. Great. And then we discover, oh, there's immune abnormalities. And then we discover, oh, there's issues with the biome. The bacteria in your gut are different in fibromyalgia. Oh, there might be hormonal issues. And then another doctor comes along and says, you know what, I think it's viral, so let's treat him with antivirals. And then other research says, well, it's mitochondrial dysfunction, the actual like cellular organs that create cellular energy. They have problems in fibro. And so you could look at either one of those and say, oh yeah, that's the problem. And basically that's what's happened. You know, the people who've discovered these individual things get all excited about it and say, oh yeah, we found a reason for fibromyalgia. We may have found a cause. And it gets into the mainstream media, and there's a whole buzz about, oh yeah, fibromyalgia is coming from small fiber neuropathy. Fibromyalgia is coming from biome abnormalities. Fibromyalgia is coming from immune abnormalities. It's hormonal. It's your central nervous system. And the issue is that it's probably all of those things. You know, each one of those things develops its adherence and its enthusiasm, and everybody gets excited for a while, and then it doesn't pan out. Well, does it pan out because it's false? Maybe not. There's no proof of this idea that a chronic illness should have one problem or one cause for it. If anything, most of the evidence we have, even from things like diabetes and heart disease, which get a lot more research dollars, are looking at the fact that these things are multifactorial. And if we look at them in a multifactorial way and treat them that way, we tend to get better results. Same story I think we're going to find out is true about fibromyalgia in 20 or 30 years when we really start studying an integrative model that looks how all these different things like inflammatory changes and hormonal changes and small fiber neuropathy and gut biome and on, all these things are interconnected with each other and they relate to each other in vicious cycles. And my background is I studied mechanical engineering, and we learned all about system dynamics. We learned about a complex system like a plane flying up in the air and various things happening to it. There's a lot of different variables. And when I got to medical school, I was struck by how everything was kind of oversimplified and they weren't looking at complexity, because it's hard to look at complexity. It's hard to study complexity. It's hard to have concrete, definable, calculatable plans when you have 20 different variables. So to me, that may be one of the core issues about why conventional medicine has been so unsuccessful at dealing with fibromyalgia and other issues. And the result of it is, we've got all these little single issues that a lot of patients have, some patients don't. So there's no consensus, right? We're not able to look at all the research and say, oh yeah, here's the problem. And so the conventional point of view is, in fibromyalgia, there is increased central pain sensitivity. Try Lyrica and try gabapentin and try Cymbalta and get some psychotherapy and try to exercise. And that's basically it, because we haven't put together as a field how all these other variables can contribute to central pain sensitivity. But if you look at the basic science, you see a bunch of underlying mechanisms that point to how all those things are interconnected with each other. Okay, so that was a lot of words. Let me sum it up with one clear take-home message. Conventional medicine has a hard time with fibromyalgia and a lot of other chronic illnesses because by and large, doctors are trained to look for one cause and one solution. And it's usually a pill or a procedure. And complex chronic pain syndromes like fibromyalgia and other related things are multifactorial. And there's a complex underlying causes that interact with various triggers and create various perpetuated complex lifestyle factors and variables. And there's no magic bullet. The reality of fibromyalgia is much different. If you look at the phenomenology and if you openly listen to hundreds and hundreds of fibromyalgia patients and look at all the literature, what you see is there can be multiple triggers, whether it's trauma, infection, stress, toxic exposure, a serious illness. There can be various manifestations. It shows up differently in different people. And there are some objective findings that show up in various research studies, things like small fiber neuropathy and central sensitization or pain sensitivity, immune abnormalities, changes in the biome, food sensitivities, hormonal changes, viral exposures, mitochondrial dysfunction, shifts in the way the stress system and the adrenal system are functioning, and also issues with the muscles and soft tissues, and so on. All of those variables can be understood to be interacting with each other and feeding into the syndrome and perpetuating the syndrome. And that's how complex systems work. You are a complex system. And so what happens in the conventional medical office or in the Mayo Clinic proceedings is we don't know what it is and we can't fix it. The issue is that they're using the wrong model. So, to me, there's a clear solution or approach. Conventional doctors more or less are trained to try to figure out what's wrong with you and to fix you. That puts you in a posture where you are passive and you're sick and you're helpless and you're ignorant, and the doctor's the expert and they're going to fix you. And that's part of why people get so frustrated and disappointed, because the doctor didn't fix them. So what I'm suggesting is that that's not a healing model. And if you want to get better and feel better, you need to shift to a healing model. A healing model is a shift in posture. It means educating yourself and being proactive and trying reasonable, safe things with a good likelihood of help, with a low likelihood of harm, and learning to mobilize your own inner healing resources and to heal. So let's talk some more about what that means. What's a healing model? A healing model, first of all, it's individualized. You are you, and you're not anybody else. I read a lot of fibromyalgia groups on Facebook to see what's going on for people, to see what they're thinking about, to see what's bothering them. And over again, I see the same kind of post. It might have different flavors, but someone says, anyone here try blank? And blank could be CBD oil, or it could be Lyrica, or it could be Cymbalta. It could be almost anything. And they're getting this kind of consensus response from a whole bunch of strangers. And in my eyes as an expert, that is completely meaningless information, because this syndrome is so varied and expression of it is so different depending on the person that it doesn't matter what other people's experience was. For sure, let me qualify that, because for sure, if you ask a question like that and everyone says, oh, that made me feel horrible, okay, well, maybe be cautious about that treatment, whatever it is. And if everyone says, oh, it was great, then maybe it's worth thinking about. But realize that you're looking at a very sort of selective sample. It's just the people who are attracted to read that as it's flying by on their feed. And they're individuals just like you're an individual, and your experience is very likely to be different than their experience. So it doesn't mean you shouldn't try new things, but it means that you should be careful about what you consider valuable information to help you try new things. It means that, first of all, think about the research. Think about the things that actually have some scientific evidence. If you're interested in trying nutritional supplements, you could go online and find out and see there's actually some studies showing that vitamin D helps a lot of people with fibromyalgia. So does coenzyme Q10. So does magnesium. These are places where, okay, the studies aren't big and they wouldn't be published in the New England Journal of Medicine, but there's randomized controlled trials showing that certain things seem to help more people than not. So that's a good place to start, right? So individualized. The second thing is lifestyle. It's really about being proactive. And lifestyle means thinking about these 3 M's like I mentioned, right? Your mind-body stuff, your movement structural system, and your metabolic sort of biochemical system. That means developing mind-body skills, working with your stress axis, transforming, meeting and transforming whatever emotional pain is following you around. Because if you've got chronic pain, you probably have emotional pain. And whether it came on as a result of the physical pain, or if it came on 20 years earlier and it's been with you your whole life, we know the physiology is that your brain is connected to your body. A lot of my patients with fibro have said things like, oh yeah, people are telling me it's all in my head. I think that's like the worst idea, not only because it doesn't make any sense, but because it gives people this sort of stigma and irritation and frustration. It's such a humiliating and dismissing thing to say to somebody. The fact is that our mind-body connection is so powerful that everything is in your head and everything is in your body. It's in your mind-body. And pain is experienced in your brain. Your thoughts and your emotions influence all of your pain processing. And your pain processing feeds into your thoughts and emotions. So it's a really integrated process. When you have a chronic stress response going on, whether it's for months or years or your whole life, that shifts so many different aspects of your physiology. It's really quite something. I'm not going to go into those details now, but I'm just trying to give you sort of an overall picture that learning mind-body skills doesn't mean it's all in your head. It means you're mobilizing the intelligence of your mind-body system. So the bottom line is stop worrying about this whole idea of, is it all in my head or not? Acknowledge the fact that your head is connected to your body. If you don't acknowledge that reality, it's very likely that your stress, frustration, anger, grief, sense of loss, isolation are going to drive your mind-body connection to make you sicker. So stop it. Instead, learn some tools to mobilize your mind-body connection to move you towards health. Next thing, nutrition, diet, your overall metabolic biochemical system. There's lots of clinical experience, lots of anecdotes, and some research that talks about diet, that talks about certain dietary change, elimination of certain foods that can be excitatory, that can actually excite your immune system, or even create a neuroexcitatory system and contribute to central sensitization. Start learning about that stuff and start working with it. If it's really hard to do, find a health coach, someone who can actually help you make positive steps. The metabolic biochemical thing is incredibly important too. And there's an analytical part of this that to do it properly, you should really see someone who's trained in functional medicine or integrative medicine, and preferably someone who's actually a critical thinker who knows how to do it properly. I've heard good stories and bad stories. I've heard about people who are not very well trained, who order a bunch of really expensive fancy labs and don't really understand the implications, and you walk out of their office with $700 worth of supplements that are prescribed because of labs that they don't really understand how to evaluate. You want someone who knows how to think analytically and critically about these sorts of things. The last part of it, we talked about mind-body, we talked about metabolism, which is your food and your nutrition, as well as like certain nutritional things that you can do, either because you're learning and researching on your own, or you're getting some specific guidance from someone who's trained. And then the third part of that is your movement system. And if you're in pain and you're exhausted, and every time you do anything, you get worse and you flare up your fibro, clearly you're not going to go to the gym and work out. Some people are in a different place. They go to the gym and they feel better. Again, everyone's an individual, so you need to find your threshold. You need to find what works for you and learn how to build and build from there. Learn how to do what you can inside your threshold. Do it regularly. It's really well known that regular activity helps your system heal in lots of different ways. It helps your body actually make your mitochondria more healthy. Those are your cellular energy production organs in every one of your cells that tend to be impaired in fibromyalgia. But again, you got to do it according to your own state of things. If you don't have any knowledge about that, again, you might want to find someone who's skilled with working with people with fibromyalgia. That could be a physical or occupational therapist, or it could be a really good exercise physiologist, or even personal trainer who's worked with a ton of people with fibromyalgia. It's very specialized. So those are lifestyle approaches. You know, the next thing, like the whole model, I keep talking about this, get out of that passive, disempowered, I'm going to be fixed by this person. Start to take on the mindset of, I am going to lead myself to help. I'm going to get advice from experts, but ultimately I'm walking on this journey. And the I is you, right? It's your journey and you got to walk on it. And no one can do it for you. And I can advise you, other experts can advise you, but you got to walk the walk yourself. So get out of that passive, disempowered, I'm broken, and on a regular basis learn how to shift your mindset towards empowered, educated, learning, growing. The last thing I would say about this particular aspect is, like, a lot of people come to me and say, okay, show me the proof. Show me the research that shows that this multifactorial thing works. And what I would say to that is, for now, get over that. Because you're not going to see statistically solid research that's going to look at a multifactorial problem, that's going to analyze 10 different interventions in a population of people who have 20 different variables that are varying from one person to another. It's just not going to happen. There are efforts underway to develop these big data projects where they're studying thousands and thousands of people and collecting everything. And it could be that in 20 or 30 years, we're going to have better models of this and more ability to predict, oh yeah, if the constellation of physiologic variables is like this, emphasize this approach. And if the constellation of variables is like this, emphasize this approach. But we're nowhere near that yet. And if you're looking for someone who's going to say, oh yeah, randomized controlled trial, forget about it. It's not happening. And that's frankly why a lot of doctors don't buy the whole integrative model, because they want to see those randomized controlled trials. And the issue that I really want to make clear to you is that it's an individualized problem, and we don't have enough data to do that in a data-based way. We've got data that shows foundational issues, relationships about various dysfunctions, certain interventions that can affect things like systemic inflammation and liver inflammation, mitochondrial dysfunction, disorders in the biome, intestinal permeability. We have data about those individual things, but you really got to be an integrator, or you can wait 30 or 40 years. It's really up to you to be kind of an early adopter who's doing common sense approaches based on foundational data and scientific principles, or to be the guy that says, I'm not doing anything until the chairman of rheumatology at Mayo Clinic tells me that's what I should do. That's your choice, for sure. I think you're making a mistake if you're waiting for the mainstream authorities to tell you how to heal your fibromyalgia. If you've gotten great results with, taking the drugs, Lyrica, Cymbalta, Savella, some of these other things, great. My guess is that whatever process created your fibro might be ongoing in the background, but I hope you can do fine on that for the rest of your life. I would love that. But I'm just speaking from my experience, seeing so many people who, they get the temporary improvement for the medication, and then after like a year, 2 years, 3 years, well, you know what? That physiologic vicious cycle keeps going, and so the medication stops working. That's what I see often. But again, the people who feel better with it don't necessarily come to me. So, it's complex. We don't have all the answers. Let's be real about that. The take-home message about this part is like this, that your chronic pain, your chronic illness is multifactorial. That's how it happened, and that's how it's going to get better. Until conventional medicine has massive, massive data sets to look at multifactorial problems and multifactorial interventions, we're not going to have good, convincing randomized controlled trials about how to do the multifactorial thing. And you got to use your common sense based on scientific principles and critical thinking about risk and benefit. I think there's another piece to add here, which is to please stop hating your doctor. And of course, if you've been unfortunate enough to meet one of those kind of malignant individuals who projected his or her own insecurity or hate or frustration on you and made you feel horrible about being you, then my heart goes out to you, and I totally get it. I've heard those cases way too many times. It's very frustrating. We have a crisis in medicine in the year 2020, especially in the spring of 2020 with the whole situation going on. But my conviction is that most of my medical colleagues are actually good people who are dedicated and caring, and they study hard, and they do the biomedical thing well. And it's the problem is that the biomedical thing is not what you need if you have fibromyalgia. And so again, I think I mentioned before, you're not going to get angry with your orthopedic surgeon if he doesn't know how to treat your pneumonia, and you're not going to expect your endocrinologist to operate on your knee or your hip. And so don't try to put a square peg in a round hole. And if you're the square peg and the round hole is allopathic sort of acute care medicine, don't try to stuff yourself in there, because you'll just continue to frustrate yourself. And realize that if your doctor is mainly oriented towards dealing with acute problems and following official national and international guidelines for chronic problems, then you got to just accept that and let that be his or her role. And so my advice to most of my patients is keep really clear records. Know the different things you've tried. Have a really clear problem list of all your medical diagnoses and all your medications. when you go to a new doctor, don't say the first thing, I have fibromyalgia, because you're going to scare them. And don't take a file this thick and drop it on their desk. But be really specific about what you're asking for. You know, for instance, doc, I know I've got a lot of pain in my shoulder. And he starts to look at the record, and you say, you know, you're going to see there in my electronic record that I got fibromyalgia. And I get that. And I know you might be thinking that it's just fibromyalgia, but here's the story. My typical fibromyalgia pain is like A, B, C, and D. And I've never had shoulder pain in this many years of having fibromyalgia. And the shoulder pain is new, and it's really intense, and it's really disabling, and I'm worried I'm going to get worse from it. So I'd like to get it evaluated properly, just the shoulder pain. Could you do that, please? And give them something specific to do so you don't overwhelm them with the whole picture, because they're not necessarily equipped for that. And again, I'm not saying this to disparage primary care doctors or conventional medicine doctors. I'm speaking about the general principle. I do know excellent internists and family practice docs who are willing to hold the complexity of your picture. And if you found that person, I am happy for you. It's great, because that's a potential team player to work with. Maybe they're even open-minded. Maybe they're studying nutrition. Maybe they're studying mind-body medicine. Maybe they did a course in functional medicine. I hope you find that person. But if you don't, and what you've got available in your small town or in your corner of the city or in your health fund where you are is just someone who's really conventional and in the box, just learn to work with it. And learn to think out of the box, and eventually, hopefully, you'll find someone who can like hold the whole picture for you. Yeah, great. My view is like this, that eventually, over the course of probably decades, conventional medicine will likely come around to a multifactorial way of diagnosing and treating chronic illnesses like fibromyalgia, but we're years from that right now. And you really have to choose whether or not you want to be an early adopter and take the basic science and basic clinical principles, and with common sense and good expert guidance, make common sense choices how to do your own kind of multifactorial approach to helping yourself heal, to empowering yourself, to educating yourself, and to finding your own inner healing capacity and developing it and stimulating it. I'm here to help with that. More videos will be forthcoming. Thanks for being here, and see you next time.